And welcome back. You're still watching Citizen Extra, the Friday edition with me, Freddie Ndimuli. We now want to switch the discussion from purely political and let's talk matters health. Now, yesterday, the government of Kenya, through its Ministry of Health, rolled out an antiretroviral drug that will be used by HIV-negative individuals who are at high risk of infection to avoid contracting the virus. Also rolled out yesterday was a HIV self-testing kit. What does this mean for Kenya's fight against HIV? In studio, we do have Dr. Martin Sirengo. He is a Deputy Director of Medical Services, also the head of the National AIDS and STI Control Program, NASCOP. Karibu sana, Bwana Sirengo.
Thank you.
Now, first things first, which drug is this? Does it have a name? Where was it before?
This is the drug. The drug is called PrEP. And PrEP simply stands for pre-exposure prophylaxis. Before exposure to the risk. So this drug is new in Kenya, and Kenya is the second country in Africa after South Africa to launch it. And it's for use for preventing HIV infections. It's only recommended for HIV negative persons who are at a continuous risk of being infected. And this includes an HIV negative person in a relationship where the other person is positive, someone who has multiple sexual partners, for instance sex workers, or anyone who has repeated history of sexually transmitted infection or burst condom.
Yes.
They're eligible. So it's not for everyone, and it's only accessed by prescription.
Yes, but we do understand that there are similar, if not this one, there's some other drugs that people do access currently over the counter that serve the same purpose. Is that true?
It's not true. The drugs that are available at the moment is what we call PEP, not PrEP. PEP, post-exposure prophylaxis. For instance, if someone had a sexual assault or rape, then they will access those drugs. That's what we've had before. That is different from this one.
Okay, how different is this?
This one is taken by somebody before they get the risk. They get into the risk space.
It's before exposure.
Before exposure. And the other one, which is post, it's taken by someone already exposed to the risk.
And like that's the one available in the market?
That's the one available.
Yes.
Correct.
Wow. Okay, now when you talk about the people who you're targeting, you're saying people who are at high risk of infection to avoid contracting the virus. And I know you've mentioned it, but please go over it again. Who exactly is the target for this?
So to begin with, this drug is not for everyone. Number two, it's not a vaccine. So I have to clarify some things. It's not a vaccine, it's an ARV drug. Number three, it's not a magic bullet. It does not prevent sexually transmitted infections. It does not prevent pregnancy. So it's meant for someone who is at a continuous risk of being infected. And this includes a negative partner in a serodiscordant relationship, meaning you have this wife of yours or husband of yours or boyfriend of yours that you have different HIV status and you are constantly together. Number two, it's recommended for persons who have multiple sexual partners but do not have the ability to negotiate for safer sex. Yes.
Okay, but don't you see therefore that there is a risk of abuse, especially by teenagers, that because we do understand they are pretty exposed, so they could be classified as people at high risk of contracting the virus, that teenagers, if they had access to this particular drug, they could abuse it?
If teenagers meet that criteria, then so be it. Then they can use it. Meaning that if a teenager, for instance, is a sex worker or has multiple partners who are not necessarily maybe defined as sexual work, can use this drug. But remember, it's prescription only. So you have to go to the clinician, you state your case, they assess you, they have to run some tests to ensure that yes, you can use this drug before it's given to you.
So you're therefore saying that this clinician is allowed to prescribe this drug to a person as young as 14 years, for example?
This drug has no age limit bound to it. For as long as someone is sexually active, and we know very well that we have young people as early as 12 years having sex. But if they do, for instance, are involved in sex work or have multiple sexual partners, then they do qualify.
Okay.
Yes.
But when you talk about risk and the risk of abuse, of course we know the current regime in as far as management of pharmacies and prescription drugs. We do understand that even some prescription drugs you can still walk to a chemist and buy it over the counter. Don't you think that this one as well will be open to abuse in such a manner?
There's that risk, yes, and we've done our due diligence. Currently, it's retailing in appointed pharmacies outlet. Within Nairobi, an example is a Linton chain of pharmacies. Or if you go to a health facility like Pumwani or a Coptic hospital, you'll get this drug. And those facilities are operating within a certain set of standards, so that they do not, we do not find ourselves in that space. Yes. Okay,
but what therefore does it mean to this campaign for protect yourself, use a condom? Because now there'll be this drug that if you take you feel much safer, because the government through the Ministry of Health and NASCOP has been engaged in a separate campaign for protection.
Yes, so as it is a requirement, before we license any drug for use in the service delivery, it must be registered. So this drug is registered, and we've worked with Farmers and Poisons Board to ensure that it's registered. For now, it's actually going to be available for free in the public health sector, but it can also be accessed privately in the, if you opt to go that way, and it costs about 20 shillings a pill a day. Yes.
The question about the protect yourself, because the campaign has been in as far as fighting HIV, is a use of contraceptive, a use of protective methods, especially the condom. Now when people are allowed, or when people have this other method of you pop a pill and you feel safe, don't you think it will affect that campaign?
That's a good question. There's no one HIV prevention measure that is 100%. So we're introducing this drug to be part and parcel of a package of interventions. This drug, when used correctly, is over 90% effective, but we recommend it to be used in combination with other methods like condom use. For instance, if you're on this drug because you're at risk, it will not protect you from getting pregnant if you're a lady. It will not protect you from getting STIs. So we are saying use it alongside other interventions like condoms. And if you are in that relationship where one partner is positive, another one is negative, we recommend that the positive partner gets treatment. Yes, as we move along.
Now back to the issue of the people who are the main targets when it comes to the use of this particular drug. Of course, you've seen discordant couples, and even during the launch yesterday, we saw some of them who attended it. Sex workers, commercial sex workers as well. But when it comes to teenagers, do you have any particular or rather any special means of targeting them in as far as proper use of this particular drug, because they are a special demographic who may not necessarily buy the message that you as a Ministry of Health is giving out in as far as the use of this pre-exposure prophylaxis is concerned?
That's an important question. One myth that goes around is that with this drug, people don't need anything else. And we would like to clarify that and say that this drug needs to go alongside other prevention measures like I've stated. For the young people, we have engaged them in different ways to make sure that they get the message. Actually, we are working with a group called BLAST that are creating awareness among the young people in higher levels of learning, colleges and universities, to pass this information. We are also going to have a full campaign on media, specifically social media, to reach the young people, to give them the information about this drug. The other precaution that we put in place is that this drug should not be treated as a morning after, where people just walk over the counter and buy it. It has to be prescribed by a clinician before you get it. And one thing to remember, so that people don't misuse it, is that this drug does not protect you if you just take it for a weekend because you're planning something, some mischief. You have to take it, first of all, for 1 full week for it to be effective. Then thereafter, take it every day, a pill every day, for the duration that you are at risk.
Wow.
Yes.
So how exactly does it work? Now that you're explaining, take it a week before, then for how many days? Go over that again. How exactly does it work?
So if you start today taking this drug, after being assessed, of course, you count 7 days. After that, then you can say you are protected. In between day 1 and 7, you are not yet protected. Full protection checks in after 7 days. Then you use it continuously, a pill every day, for the duration that you are infected. Let me give an example. If you are an HIV negative partner in a discordant relationship, you'll do that. Then we expect that the positive partner will start on treatment. So you'll take this drug. The recommendation is you take it for 6 months, a period within which we believe the positive partner will have effectively suppressed the virus. Then after that, the partner who is positive will be checked, the viral load. If it's suppressed, then the negative partner using this drug can stop. So that's one example. How it works and which differentiates it from a vaccine, this is a drug similar to, say, if Fred, you're traveling to Mombasa and you fear malaria, you will take an anti-malaria before you go to Mombasa, right? Preferably 3 days before that. So it's a similar concept. So once you load the system, it protects your cells, because normally for you to be infected, the HIV virus gets into your body and gets inside the cells. So when you take this drug, you create a coat around your cells so that the virus does not get into the cells. And then the body will naturally eliminate the virus. The reason why HIV escapes elimination by the body cells because it gets inside the virus. I mean the cells.
And you say that after this dose, you stay protected for how long?
You stay protected for as long as you are taking it. The day you stop taking it, you're no longer protected.
So once you take the 1 week before and then a pill every day, it means you take the pill for the rest of your life?
What I'm saying is, if you start today, your risk of being infected is still there until you've used it for 1 week. Okay? Thereafter, you continue taking a pill every day for the duration you are at risk. And you only stop when you have reached a point where you think you are no longer at risk. Yes. And you need the advice of a clinician to stop.
Okay. Now, because with most medication, there comes with side effects. Any side effects for this particular drug?
Oh yes. There's no medicine that is without side effects, of course, unless it's a placebo. So this drug, the common side effects include feeling of abdominal discomfort, feeling like vomiting. Some people may vomit, and occasionally feeling headache or tiredness. So the common symptoms that many people will deal with. Some people actually may not experience any side effects. Yes, the extreme side of side effects is, of course, effect to the liver, and that's why you need a clinician to assess you, run some tests, see how your liver is functioning before you are given. Are
you saying that there are people who will do not qualify to be prescribed this particular drug, and if at all, which people are these?
You may not qualify to use this drug if you have an existing liver disease, like hepatitis. Yes.
Okay. Now, finally, the other thing that you rolled out yesterday is a HIV self-testing kit. Now, what exactly is this and how does it work?
I have an example here, actually. I have 2 kits here, but I'd like to explain the reason for us to launch these 2 kits for self-testing. In the past, conventionally, you had to go to a health facility before you get a test, either VCT or a health facility. But over time, we have put over 1 million people on treatment. And we know we have about 1.5 people living with HIV. So we're looking for about 500,000 people. And it's getting increasingly difficult to get them. So we are allowing people to be able to take a test in their own safe space, in their privacy. So how this test works, I have two of them here.
Yes.
The first one I'm showing you here is a blood-based test. And this one is oral self-test. So I'll explain the blood-based. The blood-based has a cassette inside, which is this one. And it has 3 bottles inside and a lancet. So the lancet you prick yourself, you squeeze a drop of blood, you put in the center hole of this cassette. Then you put in these diluents. The first one is the red one. You put in, you let it be absorbed into the membrane until it's completely absorbed. Then you put in the blue one, you open and you put inside until it's completely absorbed. Then you put in the clear one. After that, you read your results, and what you see for those who have gone for an HIV test is similar to what you are shown. You'll see 2 dots for a positive test within that hole.
Yes.
For a negative test, you'll see 1 dot, which is similar to the lines that you'll see with a conventional test. Okay? And the results are immediate.
Immediate, that I'll see the dots immediately after I put
as soon as you put your last diluent,
yes,
you see your results
immediately. And how accurate is this kit? Do I need another test if at all the result comes back positive? Will I need another test just to confirm?
Yes, this is a screening test, and the recommendation is once you test positive, we advise you to go to a health facility to confirm. It's a screening test, because just like we do it in a health facility, you do 2 tests before you give someone a result.
Wow.
And quickly I want to go through the oral one. Yes. This is a simple test that uses a scraper. So you rub it all firmly on your gum, upper gum, then the lower one, making a 360 degree with this flat end. Once you finish, you put it into a developer. It has also what is called a solution, this one. So you put it inside for 20 minutes and you read your results again. So this will show lines. 1 line at the C means the control, it's a negative test. 2 lines at the control and the test is a positive test. This takes 20 minutes.
Wow. And you say all these are all accessible at pharmacies and clinics, or it will just be at clinic level?
For the PrEP, it's available at pharmacies and clinics. For the self-test, it's available at appointed pharmacies and health facilities. For now, we are currently in partnership with the private sector who are providing it, as we work out ways of making it available for free. So the kit is not yet free? For this time, it's not free. Yes. Yes, it costs about $8 to $10 a test.
Wow.
Which is about 800 shillings.
800 shillings?
Yes.
For each kit?
For each kit.
Okay, and it can only be used once?
It can only be used once. It's not shared.
Even for the swab, it can only be used once?
It can only be used once.
Okay.
Yes.
Well, thank you so much, Dr. Martin Sirengo, head of the National AIDS and STI Control Program. Do you have anything that you could add before we wrap up this interview?
Yes, just to urge Kenyans that these products are meant for you, so that we can all join hands together to fight the HIV epidemic. We are not yet there, so we need your efforts, and the way to get there is for everyone to get to know the HIV status. Okay, thank you so much, Dr. Martin Sirengo, head of the National AIDS and STI Control Program, of course explaining to us how the pre-exposure prophylaxis and the HIV self-testing kit work and where you can get them. Of course, the Ministry of Health through NASCOP rolled this out yesterday. They're available for free, but also at private outlets for a certain fee.